Ready to start?
Just hasn't turned on yet. Good morning and welcome to the Windsor-Essex County Health Unit's media briefing for November the 4th. This morning we have Dr. Nessa Thury and our CEO, Nicole. We are just going to start with a brief epi summary and then we'll move into media questions.
Good morning, everyone. Thanks for the introduction. I'm Nicole Thury, the Chief Executive Officer for the Windsor-Essex County Health Unit. So a little change again. We won't be having the fulsome epi presentation that we have in the past. And we will be posting our epi summary to our website as we did last week. So, folks in the media will have received that as well. It'll be available for the public. Just some highlights. So far, as of November 2nd, we've had 20,553 cases reported, and our 7-day moving average is 22.6 cases per 100,000. For the week of October 25th to the 31st, the case rate is 39.3 per 100,000, a slight increase of 11.3 compared to the previous week. And we have seen a decrease in our percent positivity, a 0.9% decrease in our percent positivity for the previous week. And again, the highest number of cases continue to be amongst youth, those 0 to 19 years old, which represent 24% of our cases for the week of the 25th to the 31st. So it's just a very quick overview, and you'll receive all of the details, and they will be posted publicly as well. And we're happy to move into questions. Thank you.
All right. Thank you. Any questions from CBC this morning?
Yes, good morning. What's the response been since you opened up booking for those third doses for those newly eligible?
So, the response has been actually pretty good. We just opened up our booking site yesterday afternoon. I know for our mass vaccination site, availability has booked quickly. So that's really good news. That certainly shows that there is interest, and we are also holding spots to continue to ensure that those who haven't received the first dose or a second dose are still able to get in. So that's an important point that I want to make sure everyone is aware of. We still have, walk-ins for first and second doses, but for anyone who is newly eligible for booster, we have had a pretty significant response. And I believe Mike could correct me. I think we did have a few issues with our just the flood of people that have gone to our web yesterday. So I think that tells you anything about response. That anecdotally the best I could share, but it's been a good response. And I don't know if Dr. Nessa Thury has anything to add.
Yeah, one thing that we would emphasize is that those people who received their first and second dose of vaccine have significant protection from COVID. And it's important to get the third dose, but to recognize that if you've had your first and second dose, you have significant benefit. And the other item is that the real public health priority at this point remains trying to get people who are not vaccinated currently their first and second doses. So we would continue to encourage people, and there are more than 50,000 of them in Windsor-Essex who are eligible for vaccine, who have not received vaccine, to get vaccinated. We also know that province-wide that the majority of people getting sick and being hospitalized from COVID are those who are unvaccinated. So although the unvaccinated constitute a small proportion of the people in the community, they are a smaller proportion. They're the people who are disproportionately suffering from COVID itself. So just to place that in context, the second item is that we think that based on the data that we have today, that the burden of COVID-19 is about the same this week as it was the previous week.
Thanks very much.
Any questions from Blackburn?
Yes. Sorry, Nicole, I kind of missed it, what the positivity rate was up. You mentioned it was up slightly from last week, test positivity?
Sorry, I think I said it was down. So there was a decrease of 0.9% in percent positivity was observed in the week, the 25th to the 31st. So it's a decrease from the previous week.
Okay, thank you. The other question I have is yesterday, the premier mentioned that he was not going to impose a province-wide vaccine mandate on healthcare workers. Mike, I know the push continues for people to get the first and second dose. Could this messaging from the province hurt your messaging?
Do you want to start, Dr. Mississippi, or would you like me to?
Sure. So, the public health services messaging is the same, and it continues to be the same, which is that as we increase vaccination rates, we provide more protection to the individuals being vaccinated, and we also provide more protection to the community. I think that the position of the medical officers of health, or at least myself as a medical officer of health for Windsor-Essex, is that hospital workers and healthcare workers have a special obligation to their patients and the people that they serve, and they should get vaccinated. Because if COVID-19 makes its way into the population of people that we serve as healthcare workers, it could have really quite adverse and devastating consequences. So the public health messaging has remained consistent, and it remains consistent for members of the community overall, which is if you're eligible for the vaccine, get vaccinated. And if you're a healthcare worker or someone who works with people who are more vulnerable to the adverse effects of COVID-19, you have a particular obligation to consider vaccination. So I don't think the message as it relates from the public health service has changed at all.
The third question I have, maybe Nicole, this is one for you, is when we started vaccinating the population, we had a number of mass clinics that were open. Now we're going to be doing third booster shots while also trying to get those people for their first and second. Are you confident that the one mass vaccination clinic in Windsor is going to be enough?
Yeah, we feel confident that it is. We also, when we did originally start vaccination, we didn't have healthcare providers or the volume of healthcare providers offering vaccination. So, things have kind of gradually shifted as well. The mass vaccination clinic at Devonshire, the capacity for that clinic is considerable. And it's centrally located. So we do feel really comfortable between pharmacies, our mass vaccination center, as well as the support from our healthcare providers, primary care within the community, that we definitely do have the capacity. Again, I would just say as well, the priority continues to be first and second doses. So while a booster, is something that's available, our priority is still always going to be on the first and second doses, and full vaccination is that first and second dose. So we will be maintaining our some capacity for that as well. In the beginning, we didn't have a mobile outreach like we do now. So when we had the number of fixed sites, we didn't have a mobile outreach, a broad mobile outreach plan like we do now. So it's just a shift, but the capacity is definitely still there in the community.
Thank you.
Any questions from Windsor Star?
No questions. Sorry, I was in on the call at the very beginning, but for some reason it wasn't dislodged here. So you're not delivering the epidemiological presentation today? Just put out the report for us?
Correct. So the report will be on our website, and you should have it in your hands as well. And I just gave the highlights for the week.
Okay, and then you may have already expressed these sentiments, but how are we doing overall without rehashing the data, which I can look at? What's your response to what we're seeing in the data this week?
So overall, our 7-day moving average is 22.6 per 100,000. So it is, we are stable. It's slightly lower than the week before. I don't know if Dr. Necessary wants to add his opinion to how he feels what we're doing.
So no one data element, captures the entire epidemiological picture, but looking at the data overall, I think that the burden of COVID-19 to the community at the current time is about the same as it was the previous week.
Okay, thank you.
Any questions from AM 800?
Nicole, when it comes to the vaccine, how has that been? Do we have enough supply for these boosters shots?
Yeah, so we do have a considerable supply on hand, and then we work with the province. We'll be working with the province and our partners to forecast, and we'll put in appropriate orders to ensure that we continue to have the supply that we need within our community. Again, for those that are currently still unvaccinated or not fully vaccinated with their first and second dose, as well as to manage boosters.
The supply we have, is it more Pfizer than Moderna, or is it very similar for those two?
I don't think I can comment on more. I think the important piece is that we have the supply that we need to respond to, to boosters, and we do know, by looking through our system, we can run reports on, which vaccine individuals received, and we'll make plans based on that.
Okay, thank you. Sorry, I was just asking. I remember before people were hesitant of getting Moderna, Pfizer, AstraZeneca. They preferred Pfizer, I guess. Are you still seeing people asking questions like that?
Not that I've heard. I would say probably we have a majority of our population that has received Pfizer at this point in time, and there was a shift in what we were receiving at a point in time. So yeah, but I haven't heard any comments around, preferences or what, related to the different vaccinations at this point.
Thank you.
Any questions from CTV?
Yes, good morning. Just wondering if you're getting questions from the people who received AstraZeneca, but maybe only one dose, because in the provincial messaging, it does say 2 doses. However, there were a lot of residents in Windsor that only received the 1 dose. So what is your message to them, I guess, that they will perhaps be in the next group of eligibility, or what are you telling them?
I'll turn that over. Dr. Mr. Do you want to respond to that? Or?
Yeah, why don't we get back to you on that on electronic communication, but it has something to do with the historical distribution in Windsor-Essex, and I just want to investigate that a bit further. So.
Okay, no problem. Also,
yeah, we'll wait for your email on that specific question, and then we'll run some data on that.
Okay, sounds good. Just another question. I know we've talked a lot about the border changes on November 8th. Are you concerned that there will be confusion when the border reopens to non-essential travel? And are you going to be doing any specific messaging related to that, or just mainly leaving that to the federal government?
Yeah, I think that the Public Health Service doesn't manage the border and the policies and procedures related to travel between Canada and the United States. And so the questions of that nature, I think, are best answered by the federal authorities or the border services, and I would redirect those inquiries to them. Clearly, we want to provide 3rd doses of vaccine for those people that are eligible at the current time. And we also want to provide 1st and 2nd doses to those people who currently are not vaccinated. And that's our priority at the health district.
I'll just supplement that, we traditionally have not done a lot of messaging around the border, as Dr. Necessary said. And we generally refer to border services or the federal website as it relates to what the recommendations are. However, we will, we always update our website to try to make it simpler, in our FAQs, or give snippets of what are the requirements, or at least link individuals to the exact, the exact place within, on the federal website or within the federal information, so they can get the information that they need and ensure that the instructions are, they receive the instructions that they need. things change, and it's just difficult for us to, it's better to always link to the right information and make sure that individuals are getting the most up-to-date information as well. Our call center will usually redirect, but will provide sort of the basic information that we have access to on what the current, restrictions are, what the current requirements are.
Okay, thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from Blackburn?
Nope, I'm good. Thank you.
Any additional questions from Windsor Star?
Yes, just one. Is there a system in place to prevent people from booking appointments for third doses before their 6-month interval? Like, does it prevent them from doing that when they go to do it through the online portal?
Sorry, just to repeat that. So your question is if they're not at the 6-month interval, if they'll be prevented?
Yes, or is it possible that somebody who only got their second dose 2 months ago could book an appointment, show up, and then be turned away?
So we just have them put their date in when they're booking, but certainly it's important for folks to know if they don't put the right information in, and that will be verified on site. So they will look to ensure that once they get on site that they do indeed meet the eligibility criteria for the interval. And so if they're not, they could be turned away. So it is important that people put the right information in when they're booking.
Okay, thank you.
Any additional questions from AM 800?
I'm good, thank you.
And any additional questions from CTV?
No, thank you.
All right, thank you all very much. Have a wonderful rest of your week, and we will get back together on Monday morning.
Thank you. Have a good weekend.
All right,
Have a
all the
good
best.
weekend.
Bye-bye.
Thank you.